Menopause. Many women arrive at their menopause transition years without knowing anything about what they might expect or when or how the process might happen, how long it might last. Very often, a woman is not informed neither by her physician nor by her elderly family members as to what to expect. So you just arrive at this stage and things start happening. And you start wondering, are you ill? Is it terminal? What is wrong with me? And women go through menopause in different ways. So it is hard to tell how it is going to progress with each person. Some women go through menopause with little or no symptoms, and others have just about everything that the literature has in it. Even while a woman is going through menopause, we cannot tell her how long it's going to last, if this is the worst you're at, or will it get worse? And when will it end? That's usually the question. The one thing for certain is that it will end. And it will end, and that the only thing that is similar about the whole menopausal process for all women is that at some point, the period is going to stop. Apart from that, anything else can and usually does happen. This time of life is sometimes called the change or the change of life, and there's a reason for that, because life really changes when mommy, auntie, the neighbor go through menopause. There's still a lot of taboo about this topic, as there are about many other topics that we have to address in my field, but fortunately more and more it is something that we are talking about and therefore learning about. Menopause, transition, and postmenopause itself is a natural life change. It is not a disease state. It is not a disorder. It is something that happens naturally. Menopause occurs when a woman has not had a period, a menstrual cycle, for 1 full year. If only it was that simple. It's not. In reality, most traditional symptoms occur during the years leading up to menopause. So by the time the period actually stops, you've been suffering for years. There are 3 phases of menopause. The premenopause, which is leading up to it. It is a transitional phase that can last 6 years or more. Yes, you heard me right. Then we have the menopause itself, which is medically confirmed 1 year after you have not seen the period. So really and truly, it's a diagnosis that is made long after the fact. And the phase after menopause is called postmenopause. So briefly, I'm going to outline the 3 of them. As women live longer, it is possible that they would spend at least 1/3 of their lives in the postmenopausal phase, essentially living with less estrogen than they started with. During perimenopause, the ovarian production of estrogens and progesterones become irregular. Now, these are the hormones that generally regulate many things in the body, but mostly for women, we're concerned about the menstruation, right? And often, it becomes, the period, the menses become irregular, unpredictable, and during this time, fertility diminishes, but it is not 0 until the official date. So yes, guess what? You can become pregnant during perimenopause. So you still have to keep that in mind. Not because you decide you stop making children, your body decide it stopped making children. Yeah, so that is something we have to look at. And that's something a lot of women, I stopped making children, so they don't even want to discuss the topic with you. But it's a fact. And I have had in my professional life to attend to 42, 43-year-old women who didn't even know they were pregnant, because they figure it's menopause, the period going to stop, and they stop bother. Yeah? So we do still need to take care of these issues. Signs and effects of the menopause transition can begin as early as age 35. Yeah, we can begin that early. Because remember I told you, it's the years leading up to it. So if the period stopped when you were 45, it didn't just start. You led up to it for quite a few years. Although most women become aware that something is happening around the 40s. And often, that's long after the menopausal window has already begun. The duration of perimenopause with noticeable body effects can be as brief as a few years, but it is not unusual for the duration to last up to 10 years. You notice as that going up, right? Or more. This is a natural part of aging. I like to reiterate, it is not a disease. Nothing is wrong with you. This is natural. Usually occurring between the ages of 40 and 58. The average age of a woman to enter menopause is 51. This has slight variation with the different geographical regions and ethnicity and so. The actual duration and severity of perimenopausal effects for any individual woman currently cannot be predicted in advance. So you can't go to the doctor and say, okay, doctor, I understand, yes. So when will it end? We can't tell you that. I'm sorry. It is not possible during the process to tell you when it will end. Before menopause, estrogen made by the woman's ovaries is used by many parts of the body, yes? Including the reproductive tract, the urinary tract, the heart, the blood vessels, the breast, the skin, the brain. So all of these organs naturally will be affected when the estrogen levels begin to drop. So there's a lot of things in your body that will be affected. On average, assuming there has been no surgical intervention, the first evidence of onset of menopause transition would be changes in the menstrual cycle. And these variations become more pronounced over time. The cycle can become considerably shorter or longer. And the flow can be significantly lighter or heavier. So it cannot be said that menopause means the period is going to go, so why is it coming more often? Why is it flowing heavier? Those are all natural parts of the process. It can skip several cycles and then come back, which is why the diagnosis is made after it has not occurred for at least 1 whole year. Now, I'm sure many of you in here are going through these things, and you have wondered from time to time, am I alone in this? Do other people suffer as much as me? God, why me? This is more than I can cope with. And I'm sure the husbands and partners also feel the brunt of it. Menopause can be officially declared after 1 year. Now, on average, women who smoke experience menopause earlier. Women who undergo hysterectomy, and I'm going to explain this a little bit more detail, will go through menopause about 3.7 average years earlier. Now, some of you may also have had a hysterectomy, which is a removal of the uterus, but not an oophorectomy, which means they did not take out the ovaries. So you did not go into premature menopause. You had your ovaries. Yes, you had the surgery, but you're feeling fine. Life didn't change like it did for the neighbor, like it did for your sister. For you, you're okay. And suddenly you start feeling these things a few years after. That's because the ovaries are the key organs for the production of the estrogen. And what really affects the woman in menopause is the drop of the estrogen. So it's not the uterus so much, which we do focus on, but the ovaries that count. And if you've had the uterus removed but the ovaries remain, you will go into menopause, but just a little earlier. Now, there are some rare cases where the woman ovaries stop working early, somewhere between the beginning of her menses, so puberty, and 40. Between that range, she goes into premature menopause. And that is usually known as premature ovarian failure. It is not considered to be the normal effects of aging, so this one is abnormal. Now, some known causes are things like thyroid disease, diabetes, chemotherapy. So if a young woman has some malignancy and had to receive chemo, this would be some of the side effects that she would go through. In these cases, what we usually do is check the hormone levels in the blood to determine whether or not she is indeed in menopause. Now, the term postmenopause, this is applied to the woman who has not experienced the bleeding for 12 months. So you actually take the date from the last period, and all that first year, she's already in postmenopause, right? So by the time you diagnose and say, okay, yes, you're in menopause, you've already been there for at least a year. At that point, yes, the ovaries have stopped functioning. And yes, you can no longer become pregnant. So yes, you could stop studying about the birth control and all those other issues that tie up your head. Nothing's going to happen there. Right? So y'all understand what that means? Right. The reason for the delay is because you can have several months with no period and then one comes. And then the fertility fluctuation. So you don't want to tell a lady, yes, ma'am, you're in menopause, and then she come back to you 9 months later with the baby. Yeah? So we take time and we be very sure before we make the diagnosis. Any period-like flow, even if it's a few spots that happen when you are officially in postmenopause, you have not seen a period for 1 whole year, and you suddenly start spotting, please, you need to call your doctor. You need to see your doctor. You need to get checked. Because this is a very serious thing, and the cause may be something minor, but the possibility of an endometrial cancer is very real. Especially for the older ladies. We do find that the grandmas who do not want to tell anybody that they, back in their young days, and they hide it for a long, long time. And by the time someone finds it, it's way advanced. Any bleeding after you have not had a period for 1 year, you need to seek medical help. Menopausal symptoms. The severity of the symptoms associated with menopause varies from one woman to another. Some women experience troublesome symptoms, while others make the transition with few symptoms at all. These effects are related to the hormonal changes that happens in a woman's body, and it affects women to different extent. The main ones that usually cause a lot of problems that we always talk about, I'll just call the 2 of them and then I'll go through the whole long list, it's quite a long list, are the hot flushes and the mood swings. The mood swings, yes? We know about those, yeah? All right. All these symptoms listed up there, you see the amount of them? All of those are what a woman has to contend with. So I would like everybody to focus on the slide and read the last part. The most effective way to discuss a difference of opinion with a woman in menopause is to keep your mouth shut. And this is why. Mood swings caused by menopause are not helped by suggestions. So it is understandable, and we ask the entire family to be tolerant. She's not going to be there in that stage forever. It might just seem like forever, because it's going to be a few years. If you're lucky, it might be about 4-6 years. If you're not so lucky, it might be 10 or more. But you won't be there forever. So keep courage. Not only humans go through menopause. Bet you didn't know that. All these animals there, we have elephants, primates, varying types of fishes, varying types of whales, all go through menopause as well. So we're going to look at the hot flushes. The hot flushes, the night sweats. And a few people actually have cold flushes. Now don't think because they have the cold flushes it's any better. It's also a horrible feeling. Do you have the possible continuous increase of arteriosclerosis, the migraines, the rapid heartbeat? So you're feeling the heart beating and doctor, something wrong with my heart because it's beating, and every time you go they tell you it's normal and they don't understand, telling them the thing beating. You're not, yeah, we've been there, and you feel that you're not fully understood and not taken seriously because for 3-4 times for the week you've gone to the doctor's office, doctor, something wrong. It is a natural part of aging. Then you have other issues like the thinning of the membranes in the vulva, the vagina, the cervix, the whole urinary tract as well. It's shrinking, it's getting less elastic. So you have issues with itching, dryness, bleeding, discharge, urinary frequency. You have in UTIs, urinary tract infections often. You have back pains, joint pains, muscle pains, and then on top of that, the osteoporosis, the bone want to break. Skin and soft tissue, the breast start to sag. You can't hold up gravity anymore. It's tender, it's swelling, it decreased elasticity of the skin, and then you have formication. This is where you have the itching, the tingling, the burning, the pins and needles, ants walking up your foot and you're slapping and they're telling you nothing there and they're watching you as if you're going crazy, but you know what you're feeling. And it is there and it is real. Crawling under your skin, you know it have something there. So you start to deworm. Because you sure is worms, and them children might pick up worms and give you, and you start to do all kind, but nothing stopping it, and it crawling more in the night, so you can't sleep, and you couldn't sleep already. So now you really cannot sleep, because the psychological issues are depression, anxiety, you're getting old, fatigue, you're irritable, and you start to lose your memory. So now you know you're getting old. Problems with concentration, the mood disturbances, the sleep disturbances, the poor quality of sleep. You're sleeping light, so everything that passes, you hear it, you wake up. And then the thing crawling up your foot. It's a lot. And we still haven't finished yet. We haven't finished yet, we have more. You have the sexual issues. Because remember the first part I tell you, it get thin, it dry, it not stretching no more. So now it hurting. And you don't want them to touch you because the thing crawling on your leg. And that hurting too. So you understand? So now you enter with all kind of other psychological issues like the marital issues. So they're coming for Pastor Sanford to counsel. And he counseling about all kind of things, but here reaching the issue is that you can't handle that on top of all that you have. And you think we're done? We still have more. We have more. Yes. Now during menopause, some women have to deal with a lot of stressful things that happen in your life because you're not having menopause in isolation. Your whole life is still revolving. So you have to deal with caring for the death or an elderly parent that may suddenly move into your home. And they cantankerous. And they have Alzheimer's. And they're forgetful. And you take me thing, and all you think are stupid, but I don't stupid yet. And you have your problems for yourself, and you have to deal with this, because you are the carer of the home. Then you have the so-called empty nest syndrome. Them children gone. They gone to university. Thank God they get a scholarship, but oh gosh, they gone. They're not there. Me one. They're not coming home in the evening. I mean, some fathers, I remember, just to break off a little, I remember when I was going to university, we were all, the students excited, going on the plane, all our mothers close by, and then I suddenly saw an exodus of all fathers heading off in one direction. All mothers start to cry, all fathers run in the next direction. Yeah? So fathers may man it up. They're feeling it too, but they're manning it up. But you sit down and cry because my baby gone out in the world. And on top of that, you have all what I call before, because you're in menopause, perimenopause. And now the period coming every 2 weeks. And it coming heavier. And you have all these things crushing in. And life still goes on. You still have to get up, get dressed, prepare the home, go to work. You're in work, you can't concentrate, you can't focus, you didn't sleep good, the thing's still crawling up your leg. And you know when you go home tonight, you're still not going to sleep because it's going to be crawling up your leg still. All of these things are natural. It's a natural part of aging. And it will stop eventually. Eventually. Then you have, I ain't finished yet with the symptoms, We ain't moved on yet. We're still on the symptoms. Then you have the birth of the grandchildren. You're happy to have them. But then sometimes you have to care for them. And these little ones, you like them when you're cooing and thing. But when they start to crawl and creep and pull down everything, my days for that done. Now we're back in it again. But then you have grandchildren. So now you're old. Yeah? No, it had nothing to do with age, feeling. You're grandchildren, so you're old. Never mind, you're 35 or you're 40, you're just into 40 and you're looking fine, you're feeling fine. You're old. Because everybody, she have grandchildren already, she old. Don't bother with her, she just looking so. They know your age, they know your business, but they know you have grandchildren, so you have to be old. And there's this whole connotation to it of being old. Yeah? And we're going to get to that. Now we're going to talk a bit about the treatment. Yes, there's treatment. Now, although it is not a disease, so we don't have a cure, it will stop. So we don't have to cure it. It will stop on its own. It's natural. But there are a few things we do to help you get through it. And we deal with hormone replacement therapy because we started talking about the estrogen, which is the hormone that was dropping in your body and causing all these effects. So we replace it for you at low doses just to minimize the effects. And then we slowly wean you off it because your body stop it abrupt. We're going to give you some again and taper it down slowly. Now, in the context of menopause, it is called hormone replacement therapy, or HRT. And this refers to the use of estrogen and progesterone in women who have their uterus intact. In a woman who does not have the uterus, like we explained previously, you had a hysterectomy, but they did not take out the ovaries, so you went into menopause. Normally, we will give you estrogen alone because the progesterone is used to calm the proliferation in the uterus. But if you don't have one, then we may be causing more harm than good. So that is left out of the therapy. In addition to the relief of hot flushes, hormone therapy can alleviate the vaginal dryness, improve the quality of your sleep, and the joint pains. It is extremely effective in preventing bone loss and the osteoporotic fractures. A woman and her doctor should carefully review her situation, her complaints, and her relative risks to determine whether the HRT, the hormone replacement treatment, and other therapies outweigh the risks involved, because there are risks. Once you start tampering with what nature has given us, there are risks. But sometimes, many times, the benefits outweigh the risks, and therefore it is given. There are other therapies such as the selective estrogen receptor modulators. Some of these you may know the terms, they look big and cumbersome, but they are actually quite simple. Now this category of drugs are agonists and analogs to the estrogen. So it's like we're giving you something similar to estrogen, not the estrogen itself, but something similar. And they will go to the receptors of all the organs that we outline and act like the estrogen. The most common ones are the raloxifene and the tamoxifen. Here we may know a lot about the tamoxifen because it is usually used in the treatment of the hormone-sensitive breast cancer. So we use it a lot here in Grenada. And they also use the raloxifene because in addition it prevents the fractures. It affects the osteoporotic process and reduces the risks also of invasive breast cancer. There are other category of drugs that we use, the antidepressants. Now this one I have to pause. Because of the taboo surrounding mental health, we have a lot of resistance from women when we try to use the antidepressants for menopause. So I'd like you to listen attentively. Now there are drugs such as Paxil, I won't call out the other long name, what you know, Paxil, Prozac, and the Effexor. You come, we discuss it, I explain the benefits I give you, and you reach the pharmacy. And they tell you, hey, Miss So-and-so, that, what you taking that for? That is for mad people. So you come back to me 2 weeks later with the same symptoms you came the first time, and I'm wondering, well, maybe it's not strong enough. Maybe I should add something. Maybe I should, and you're not telling me that you didn't buy it. Of course, I didn't say that the medication was cheap, so sometimes when you hear the price, you start feeling better. But it does help. It does help with the symptoms, and if you didn't take it for whatever reason, because they say it's for mad people, it is prescribed for this. These drugs are used for many other things besides the mental health issues. And in the list, the long list of symptoms that we discussed, we do have a lot of mood issues, depression, anxiety, and we do have good cause for it. Sometimes we need a little help, and we need to know when to ask for the help, and when the help is given, to accept it graciously. As I said, the same thing for menopause. It's not going to last forever. It will end eventually. So the antidepressants have been used with some success for the hot flushes, improving the sleep, improving the mood, and generally improving your quality of life. Okay? So if you're prescribed that, please adhere to your doctor's advice and take it. Other drugs that are used are things like the gabapentin, which is the brand name Neurontin. I think we know it by that here. And they are anti-seizure medications. So again, we end up with the same thing. You go to the pharmacy and they say, but that is for people with epilepsy. I never know you had epilepsy. The drugs are used for other things, and in this case, the gabapentin has been shown to be as effective as estrogen when you're dealing with the hot flushes. And those can be bad. We can attest to that, right? So it does help. Then we have another group of medication, the blood pressure medications. And you have clonidine, the catapress. Now, some people are already on this medication for their hypertension, or if they're hypertensive, your doctor may switch your blood pressure medication to this one because it not only lowers the blood pressure, but it is as effective as the antidepressants. And then you don't get that you go to the pharmacy and they ask you if, this is for mad people. It's for pressure, and they know you have pressure, so that's okay. For the hot flushes, but it does not help with the sleep and the mood and the quality of life. So there is some room for the use of the antidepressants still. And there are other drugs like the Fosamax and the Actonel and the Bonivia. These are basically to treat the osteoporosis, the brittle bone that you're going through. So they're not for the menopause precisely, but some of you may get these drugs prescribed for the osteoporosis. Other therapies. Now, in terms of managing the hot flushes, there are things that we can do as first line, and then if those don't work, we move on to all things like the HRTs and so. In terms of managing the hot flushes, lifestyle measures such as drinking cool liquids, staying in cool rooms, never being away from the fan. You know they have those little cute little portable fans now and it's squirting water and thing? You need to get one of those. Remove excessive layers of clothing. Now we here in the Caribbean have a habit. It related, you know, but I have to say this. Every time it have a funeral, I get impatience. Somebody must fall down. They're too hot. Too many clothes. And it's black. And the funeral is 1, 2 o'clock. And then you walk into the cemetery. You will fall. Ladies, no, I'm not telling you to go and expose yourself. You know, don't go and say, Dr. Brave Boy, say I'm in menopause, so I must take off my clothes. I didn't say that. What I am saying is, you choose lighter colors, thinner material, cotton, soft material, blue, things that allow the breeze to pass so the days for the tight up will come back later after the hot flushes pass. But why is there loose clothing? And avoiding things that we seem to like here, the spicy food, hot drinks, alcohol. Some hot weather, even a warm room, can cause you to have a flush. Now, hot flushes sometimes come on suddenly and can last anywhere from 30 seconds to maybe 4 or 5 minutes. And when that happens, everybody else okay, but you start to pour with water. And you're wetting till you're dripping on the ground, you're wet. And when it happens in the night and you have the night sweats, you have to get up and change. And it's poor the husband because the fan here and the fan there, and he wrap up because he cold and you're hot and you're sweating. Oh gosh. And it's oh gosh. You're fanning with the hand and the 2 fans on, because she really is burning up inside. It feels like a fire lighting inside you. And it's hot, it's real. Some of the things, get a cool drink, wipe with wet the water, the rag, the towel in the ice water, pass it all over. And as I told you, it will end. Eventually. Or you can just do like my friend Carol. Open the fridge door, make some room, and sit down. It works. It works. Yeah? We could always do like Carol. Now, other things we need to do that can help. Optimize your sleep. Because we know we have difficulty with sleeping. We know the thing crawling up the leg. We know we're sweating already. Don't go and drink coffee during the day. Plan to exercise during the day, but not right before bed. If the hot flushes disturb your sleep, you may need to find a way to manage them adequately before you go to bed, like Carol. You need to exercise regularly, at least 30 minutes. I'm sure that people are tired of hearing the doctors say exercise. We prescribe exercise for anything. I mean, from the time the patient walks in, you could say exercise, right? And there's a reason for that. It really and truly helps. Now, you're hot. You're sweating, and doc telling you exercise. I didn't tell you go and run in the midday sun. In the evening when it's cool, you take a walk, you take a swim, you use a stationary bicycle, and you could put on the fan. I didn't tell you not to put on the fan. Yeah, you could put on 2 of them, but exercise. Because by doing that, you remain healthy and you decrease your risks. Because remember the long list of symptoms. Cardiovascular risks are involved. So by controlling that, diabetes, osteoporosis, all these things are improved with exercise. So exercising is important. The lack of lubrication is another common problem. So you can use over-the-counter water-based lubricants such as the KY jelly or the Vagisil. They help with the overall dryness. because the lubricants can help it to not be as difficult during intercourse. And the other thing that helps is actually staying sexually active. It does help. So yes, I know the thing crawling up the leg. And yes, you're hot. And yes, you're moody. And yes, you feel you're getting old. And yes, hair starts to pop up on the face and you're plucking with the tweezers. And yes, can't defy gravity no more, it starts to drop. But those are not excuses to change that part of your life. Actually does help. Low dose prescription vaginal estrogen products can help. It helps with the thinning of the lining, the itchiness, the whole irritation. And same thing, gradually we ease you in to accepting it how it normally will be. And it will not be back to how it was, but it will be acceptable and not as uncomfortable. The risk of acute myocardial infarction, otherwise known as heart attack, and other cardiovascular diseases rises sharply after menopause, because when the estrogen goes, your protection that you had, yes, women are at a less risk of this because of the estrogen. When the estrogen drops, that protection is lost, and it suddenly rises to be that equal of men. So you're now at risk for heart attacks and other cardiovascular events. And all of this can be minimized and improved by managing your risk factors. So no smoking. If you are hypertensive, take your medication as prescribed. Back to the usual thing we prescribe, exercise. Low salt diet. If you're diabetic, take your medication, exercise, and diet. If the cholesterol is high, take your medication, exercise, and diet. We getting the gist here? All the chronic diseases include take your medication, exercise, and diet. The diet just means watching what we eat, watching the portions. Because the other thing that happens in menopause, we stop looking like pear and we start looking like apple. Yeah? You notice that, eh? And we tucking and we pulling, but you can't stop the midline spread. And when you put on the weight there, you can't seem to drop it. You're doing the same thing, you're eating the same amount, same physical activity, but the weight piling on. That also is natural. So you need to decrease the portions. Not stop, decrease the portions that we consume and exercise more. You need to practice relaxation techniques. There are many videos and books that can help you with this. Deep breathing, guided imagery, progressive muscle relaxation. All of these will help you get rid of the stresses that you brought from work that you're getting at home. A little you time. A lot of time we get tied up as women in the family. And you're so integrated in the family that when you are asked the question, when last you did something for you, you can't even remember. Because you are the hairdresser, but you're studying the groceries you have to go pick up, or this you have to do, and the kids drop off to swimming, you have to pick them up, and you have no time where you switch off all the other on buttons and take care of you. So that is also important, very important at this point in your life. Eating well. Eating balanced foods, fruits, vegetables, whole grain, limiting the fats, because we stop looking like pears and we start looking like apples. So we need to eat right. Another issue we need to deal with is the pelvic floor, because at this time we've finished, we've gotten the diagnosis of menopause, so we know no more babies, but we've already made all the children, we've already gone through all these issues, all these traumas that have happened to our pelvic floor. We need to now strengthen it, so that when you laugh, you pee yourself. Happens all the time. Yeah, because the pelvic floor is weak by all the traumas that has happened to it throughout your life. So you need to work on that. And there are exercises that you can do, Kegel's exercises. You can look it up on the net anyway, Kegel, and they will show you. It's quite simple actually, and it does work to help. It's actually a treatment that we prescribe for persons with urinary incontinence, so it works. Don't smoke, because that increases your risk for getting the menopause earlier, menopause lasting longer, heart disease, stroke, osteoporosis, and a whole other range of things. Now, sometimes individual counseling and support groups can be helpful when you're handling persons that become sad, depressed, anxious, or just confused. Help someone with the whole process, just letting them know that they're not alone, that others have passed through it as well, can be very, very significant at a time like this. Then we have to deal with alternative medicine. Now, it is important to examine the claim that herbal remedies help relieve menopausal symptoms. There are some botanical sources which are referred to as phytoestrogens. However, systemic reviews of intervention studies question the validity of the proposed benefits of the phytoestrogens. There is little data in postmenopausal women to support the role for the phytoestrogens as an alternative for the conventional HRT, hormone replacement therapy. There's a product that some of you may have heard of, Femarel. It's a mixture of soy derivative and flaxseed, which are things you normally consume anyway. It's a 3-to-1 ratio, so they have 344 milligrams of soy and 108 milligrams of flaxseed, and they mix it together and they have a powder that is 430 milligrams. And it is being promoted for the treatment of menopause and the prevention of the bone loss. And it's also said to have similar effects like the tamoxifen and the raloxifene that we spoke about earlier. And therefore it can reduce the risks associated with using estrogen and estrogen-like therapy. In 2008, the European Food Safety Authority concluded that a cause and effect relationship has not been established between the consumption of Femarel and an increase in the bone density, an increase in the bone formation, or a decrease in the osteoporosis, or any other disorder of the postmenopausal women. Now, we need to be careful. All those symptoms we listed before, all the psychological symptoms, we want relief, we want something to stop it now. And if they come and they tell us this will stop it now, we will buy it, even if it's $150 for a little packet, so because we want it stopped now. Of course, when we take it and it don't stop, somebody is going to pay. But usually the person who needs to pay is long gone. So we need to, also keep our head on where you get these Fixols and Curitols 1-pack, because it will stop on its own. So don't lose courage. It's just that it will stop eventually. In the area of complementary and alternative therapies, acupuncture and acupressure are therapies that are promising. So we have some hope that they will come up with a definite scheme that we will be able to start prescribing, hopefully, where the acupuncture, which is with the needles, and the acupressure, you actually just use the fingertips, can help in the relief of some of these symptoms. So we are all waiting the studies and hopeful that there will be something useful coming out of that. However, we are already seeing conflicting studies, some showing benefits and others showing that there has been no effect whatsoever. There are regular claims that the soy isoflavones are beneficial concerning menopause. However, there are no distinct studies to prove that any of these things actually make a difference to the menopausal course. So basically, the cultural context within which a woman lives can significantly impact on the way she experiences the menopausal transition. Research indicates that whether a woman views menopause as a medical state or an expected life change will impact on the way she experiences it. A lot of it has to do with how you look upon the change in your life and the effects that it will have. A lot of it has to do with the education and preparation that you have leading into it. A lot of it has to do with your support system. The persons that are there for you in your little nucleus, the extended family, the church groups. Determining how you look at it will determine how you experience it. And now we move on to the topic that Pastor Simon has been speaking a lot of interest with, and that is the andropause or male menopause. Sometimes it is colloquially called manopause. So it's not womanopause, it's manopause. And it is a name that has been given to a menopause-like condition in aging men. Now this relates to the slow but steady reduction of hormones, the testosterone and the dihydroandrosterone in middle-aged men, and the consequences of said reduction. Unlike women, middle-aged men do not experience a complete and permanent physiological shutdown of the reproductive system as a normal event. That does not happen. A steady decline in the testosterone levels with age is well documented. Unlike menopause, the word andropause is not currently recognized by the World Health Organization and its ICD-10 medical classification. It is likely because andropause is a term of convenience describing the stage in life when symptoms of aging appear in men. While the words are sometimes used interchangeably, hypogonadism is a deficiency state where the hormone testosterone goes below the normal range in an aging male. So that is more widely accepted. The impact of the low levels of testosterone has been reported, and several symptoms have been identified, such as nervousness, depression. I can count them out on my fingers. There are some, but they're not as many as what we saw before, right? Decreased libido, decreased potency, impaired memory, difficulty with concentration, fatigue, insomnia. Some men do have hot flushes, and sweating. So if you're fortunate or unfortunate, both of you may go through the pauses together. So when the fan is on, the 2-3 fans, nobody ain't cold, everybody hot. Everybody sweating, so we installing a whole AC unit for you alone. It has been found that lower than normal testosterone levels cause these symptoms, and when they are given replacement therapy, the symptoms do improve. Andropause has also been associated with Alzheimer's disease. Now, a lot of these things are associated with the whole aging process. In one study, 98% of the primary care physicians believed that andropause increased the risk of osteoporosis as well. The term symptomatic late onset hypogonadism, SLOSH, is sometimes considered to refer to the same condition as andropause. Some researchers prefer the terms androgen deficiency of the aging male. So we end up with Adam. To be more accurate and to reflect the fact that you have a loss of the testosterone production as being the main problem. In contrast to the abrupt decrease that you have with the estrogen when you have women and menopause, therefore you have a more abrupt set of symptoms. And sometimes the D is called decline instead of deficiency. Now, in some contexts, the term partial androgen deficiency in aging male is also used. So they started with andropause, they went to hypogonadism, then they decided to call it SLOSH, Adam, and Padam. But whatever it is they do call it, all agree that something happens, and it is something that we need to pay attention to. The persons that support the whole theory of andropause believe that the condition has its own entity, and therefore the biological change experienced by men during the midlife is often compared to the menopause. But menopause is the complete cessation of the reproductive ability, whereas andropause is the slow decline, and you can have men reproducing even when they're going through this phase. Andropause usually occurs from 35 years onwards. Yes, from 35 years onwards. But remember, it's not as rapid as it happens with women. So the testosterone levels decline 10% every decade after the age of 30. So that's just 1% a year. So it's declining, but slowly. There is also a condition described as premature menopause. Now, this can occur in a male who experiences excessive female hormone stimulation. Now, I said female hormone stimulation. I did not say excessive exposure to females. Because, you know, sometimes you have 10 daughters and then the last child is the son. And he grows up in a home with so much female inundation that it can affect them psychologically and how they are able to function. That's not what I said. I said exposure to the female hormone. And this can happen in men who work in the pharmaceutical industry, plastics factory, near incinerators, and also on farms that use pesticides. Now here in Grenada, we've gotten a lot to using pesticides, herbicides, fertilizer, no longer the manure, the whatever. We need to be careful when we're using these products because they do have repercussions. Now by their mid-50s, about 30% of men will experience andropause. About 5 million American men do not produce adequate testosterone and therefore are in, whether you call it andropause, SLOSH, Adam, or Padam, there are about 5 million men in America that are experiencing this. Of course, we have no statistics of how many men in Grenada because this thing is more taboo than the mental health, so nobody's going to admit that something is wrong, even if there are many things that we can do to help. In Australia, about 1 in every 200 male under the age of 60 are affected. But once you get over the age of 60, about 1 in every 10 men are affected. So it seems that after the point of 60, the decrease is a bit more rapid. And that, again, is a natural part of aging. Regardless of the location, it is likely that males who have certain conditions will go through andropause earlier. That's normal. Diabetes, hypertension, and other chromosomal defects, they will go through andropause earlier. And these are some of the effects that we're having for it, because if the sugar is high and the pressure is high, then you can't expect everything to be working fine. So when you're having problems with that, you know, they come and tell you, well, doc, I have problems with nature. Did you take the pressure tablet? Well, no. Yes, I have some. When last you take it? Maybe last month, maybe the month before. You're exercising? Well, not much, it's raining a lot. You're not taking the medication. You're not exercising. You're not watching your diet. The only reason you came is because you had problems with nature. Not because the pressure high, not because the sugar high. But those were the things that affected the nature to begin with. So you need to take care of yourself, men. Take care of yourself, and if you have a chronic disease, you need to take extremely good care to prevent these repercussions, which are usually irreversible. Some of the current popular interest in the whole concept of andropause is fueled by a book that has been written, Male Menopause, by Mr. Jed Diamond, who's a layperson. The concept of andropause is perhaps more widely accepted in Australia and some parts of Europe than the Western world and here where we are. There are persons who oppose the whole issue of andropause. There are many clinicians that believe that andropause is not a valid concept. It is not. Because men can continue to produce up to old age. Their reproductive systems do not stop working. It drops, yes. Some men experience the loss of libido, the erectile dysfunction, and so. And you list those as andropause. They call it a normal process of aging. Some clinicians argue that many of the symptoms are not specific enough to warrant the description of a whole new condition. For example, if someone is overweight, they can be treated misguidedly for andropause when the problem is the weight. But they focus more on diet and exercise. And others focus on the depression and the problems of middle-aged men, which usually go undiagnosed. So the following treatment may be effective: the hormone therapy replacement, and we're back to the same things we always say: exercise, dietary changes, stress reduction. Leave the stress at work, at work. Leave the stress at work, at work. Yes? And deal with the stress at home. As well as selective androgen receptor modulators. These are some of the treatments that have been proposed to deal with andropause.
Dr. Brave Boy, evening audience. I need some help. What a man should do and should not do when a lady going through menopause. Because I had an experience once and I didn't want to go through the experience again. And the reason I'm asking that because I was in the hospital when my lady was giving childbirth, and I was there. And I can remember the doctor said, help. So I pay with my big mouth and say, push, push, and I got a cuff on my belly. So before I go through that, I need to make sure that happens again. So I need what a man should do and what a man should not do when his lady is going through that period.
Sometimes your opinion, how it is given, come across the wrong way during this period of time, because what is said and what is heard sometimes are two completely different things. She heard what you meant to say, not the words you said. And that complicates life. But the best thing you can do if you have your partner going through menopause is being supportive and understanding. A lot of it also has to do with the relationship you had prior to this period. It's like all stresses that a union goes through. There's no smooth sailing. If you have two people trying to coexist as a unit, there will be friction. There will be things that some need to compromise on. And believe it or not, as women, a lot of compromising takes place before it even reaches the argument stage, to go on the bargaining table and show that I have compromised here, there, and everywhere. When she gets to the menopause period, there will not be a lot of compromising on her side. So a lot of the compromising will have to come from you. And keeping the courage and knowing that it will end eventually.
If every time your periods, before the periods or during the periods, your pressure goes up, could this be a sign of premenopause?
Yes, it actually can, because the hormonal fluctuation that happens, we know that high blood pressure responds a lot to stressors, responds to the change in the catecholamines, etc., that happens in your body during any stressful event. And menopause itself is stressful, and the fluctuations of the hormones can cause changes in things like the blood pressure level.
Thank you. And like lightheaded, you're always feeling lightheaded, especially when you sit and you stand up or walking, because sometimes you just feel like you're going to fall. Could that be a sign of premenopause?
Yes and no. First, it will be a diagnosis of exclusion. So first, you have to go to your medical practitioner for them to exclude a whole host of things that can be causing that. And if it's none of the medically documented things, then we call it perimenopause. Eventually, we'll get the concrete diagnosis a few years from now.
After menopause, if you have fibroids, could it shrink?
Yes, it usually does, and that's actually part of the treatment. For fibroids, we usually do the wait and see, and this is where I get a lot of the issues in my questioning, and I realize what I said at the beginning, that women do not know or are not spoken to about the whole menopausal process. I would ask you, around what age women in your family goes through menopause? Your mother, your aunt, your sisters? And more often than not, the answer is, I don't know. This is not something that we discuss here in our culture. Where I trained in Cuba, everybody could tell you. They could tell you the age, the day, the date. But we don't discuss that a lot here. So it's usually difficult for us as physicians to say, okay, we're going to wait and see. But we usually do an expectant approach. And if you're close to menopause, already in the 50s, and based on the size of the fibroids, we may decide to wait and hope that they shrink. But in medicine, 2 and 2 is not 4, and they do not always shrink. We've had cases where a 60-year-old woman had to be treated emergency because the fibroids burst.
Based on the symptom that your mom may have during her menopause, could it carry on to you, pass on to you, or everyone is different?
As I said, the one sure thing from one woman to another in menopause is that at some point the period will stop. Eventually, yeah. At some point the period will stop. The eventually is for the everything else stopping. But at some point the period will stop. As to the family effect, yes. That's why we generally question, how do women in your family go through it? It does have some effect, but it does not predict or predate what will happen, because it's an individual experience, but it gives us some idea. If you have different factors that your mom or sisters did not have, like you had cancer, so you had chemotherapy or so, that will make your case worse than theirs, or vice versa.
Thank you.
You're most welcome.
You are saying tonight that all women must go through menopause? So, unlike men, all men must go through andropause?
No, only about 30%.
Thank God. So, based on your experience, can you give a man a tip that he would not go through andropause?
Yes, actually I can.
Okay.
This time we leave out number 1, which is take your medication, because there's nothing wrong there, and we go to exercise, diet, eat healthy. And hopefully, and then we add in the number 1 in the back, hope and pray.
Right. So, while it is true that while a woman goes through menopause that she is not interested anymore with relationship in terms of sex?
Yes and no. As I told them, and many people responded surprisingly, sexual relations actually does help, sexual intercourse does help when you go through menopause, because it is proven scientifically all the benefits of sex. It's a stress reliever. It releases good hormones in your body, and therefore a lot of the problems that you have can be positively affected by that. But then you have something crawling up the leg, they're dry, it hurting, you're not understanding, she vexed with you for something, you didn't throw out the garbage soon enough, you did all of that, she took to bed. So as a man, you have to work with all of that. You have to be on the P's and Q's. Of course, you can't take out the garbage too soon, because she's going to be vexed with that too. So you have to know the road you're trotting. Unfortunately, just as the course of menopause cannot be predicted, neither can be the course you have to travel. So you have to navigate as best you see how, in the moment,
right,
to avoid conflict. Avoid conflict. And if it means yes, yes, okay, yes, then that is what you have to do.
Right, but if that same person lost that desire, what can the man do?
Very valid question. The first thing is to open dialogue. Open dialogue about it. Because it was not an automatic loss. There are causes. Open dialogue and try to determine, seek help if you need with that dialogue, because sometimes at that period it's difficult if you don't have the type of relationship where you had those types of conversations before. It might be a difficult subject to broach. So you may need to seek, as I said, counseling and so. It doesn't have to be a counselor. It can be an elderly relative, someone both of you respect and who's confidential, to open dialogue about what is causing it and what you can do to help, because everyone is individual, and something that may please one woman will not please the other, to bridge the gap. So you have to talk with each other, figure out what caused it to begin with, and therefore how you can mend it. But it's a serious problem that causes breakups, because while she's going through this, she doesn't want you touching her. You having your own midlife crisis and want to be young again. And then there's all the other outside influences, and this causes serious trauma to the family. So support structure, dialogue, dialogue, dialogue.
Thank you.
You're most welcome.
Good night, everybody.
Good night.
Doc, good night. You talk about spotting after the periods. How soon after the periods does somebody is spotting come about?
The spotting of concern would be when you're declared in menopause. So that would be after you've had a period and then none for at least 12 months. Yes, you're in menopause. Then you have spotting. That's of concern. But in the perimenopausal phase, it's expected, because you may have no period for 3 months and then you spot for a month, 2 months, then you bleed heavy and then nothing again. That's expected leading up to it. But once 12 months have passed, you're declared in menopause. Any bleeding after that is a problem.
Okay. Another thing, if somebody had a tear, right? Could that lead to the spotting also?
Yes, because as I said, you need to get it checked, but some of the causes can be something minimal, especially like that. I was about to tag that onto the last response, because remember I said dryness, loss of elasticity, and if you don't use a lubricant, it's going to be painful. And some women are accustomed to accepting a lot, and you don't want to complain because you're tired, say no, and you don't want him go elsewhere. It hurts him, but you let him, and then you spot him. So now you're worried. Yeah, but it's good to get it checked out and make sure that all is well, just in case, because the menacing thing is that the spotting can mean endometrial cancer, which is cancer in the inside of the uterus.
How long will that spotting last for?
The spotting?
Yeah, how long?
If it's from a tear or so, it will last maybe a day, 2 days at the most.
And if it go over 2 days?
Then it's not from a tear. It's either not from a tear, let me clarify, it's either not from a tear or you have a bleeding disorder. Because some people, if you take out a tooth, all next week you're bleeding from the tooth still. If you have one of those bleeding disorders, a thalassemia or something, then the spotting may continue for longer. But other than that, normally, it's like if you get a cut, it will stop bleeding. Unless the irritation continues. So you did it last night, tonight, tomorrow, you'll keep spotting until you stop. Okay?
Okay, thank you very much.
All right.
Night, everyone. Doc, mine's a simple one. The advantages and the disadvantages of a woman going to menopause and a man going through andropause together.
The main advantage would be when all the fans on, everybody cool. Because I have vivid memory as a child of my father fold up in this blanket and mommy had the AC going and she hot and she fanning in the AC. And daddy want to sleep on the couch and she vexed. No, since we married 35 years now, we're sleeping in the same bed. We're going to sleep in the same bed. So he has to stay there. And that can be, it can be traumatizing because it's every day this going on, This is not once or twice. She's doing this every night. You're freezing. Every night, month after month after month. You self started to ask, when will this end? So that would be a benefit in that. You have that. But as I said, only 30% of men actually do go through andropause. So it's not, a high possibility that you may. The disadvantages come in with the other things. Because she's depressed, you depressed. Who holding up the family? She moody, you moody. What is the glue to keep you all together? To prevent the splitting up? She can't concentrate, you can't concentrate. Neither of you could remember anything. See? So those would be the disadvantages of it, in that you end up with the tail wagging the dog in the home, and a lot of conflict because she's saying that she told you and both of you come home and left the children. So those would be some of the challenges of both persons going through at the same time.
A pleasant good night to everyone. Dr. Braveboy, concerning rapid heart palpitation, I experienced that for maybe about 2 months. But I was scared to go to the doctor because I thought he would have said I had some heart problem. So I enjoyed it. I drink a lot of water and I took aspirin. Didn't go to the doctor. It has stopped for a good 3-4 months now. Do you think it would reoccur?
Yes and no. It may or it may not. As I said in the presentation, even while you're going through the process, we cannot predict which course it will take. It may be sporadic. Next time it may come for a day or two and then go. It may never come back again. That does not exclude the possibility that something else might be wrong with you. All of these diagnoses are a diagnosis of exclusion. You may have a thyroid problem. Gives you palpitation, nothing wrong with your heart.
No, I checked that.
You may have low blood, anemia. Gives you palpitation, nothing wrong with your heart. Yeah, so there are several other medical conditions that you may have that caused the palpitations. You may have been under a very stressful period that you thought are not taking it on, but you're taking it on. And you're on the rocking chair of worry, back and forth, and you're going nowhere, but you're sitting there. That could bring it on as well. So there are many things that could have caused it that are not related to the heart. There are many things related to the heart that could have caused it. And as well, it could have been the perimenopause. But once you get it checked out and it's none of these things, we say it's the perimenopause. And it may or may not reoccur.
Thank you.
You're welcome.
Okay, like when a woman is going through her menopause, could it cause her to mentally sick, like you say, lose her mind and get to the mental home?
Well, it is a possibility, and it's a very important question, because as I described in my presentation, a lot of the issues that are here are psychological. The treatment is sometimes the antidepressants, and you go to the pharmacy and they tell you this is for mad people. So yes, and in Grenada we only have the madhouse. For persons who have issues with drugs, and so we don't even have Carlton Home, they also go to the madhouse. For persons who need psychological assessment, we no longer have the psych unit at the hospital, so they also go to the madhouse. It's the only place we have left. So here in Grenada, we have this connotation that we attach to once you go to the madhouse, and we have to bridge that, because there are a lot of services administered there that are very valuable to us. Sometimes we need evaluations for things that will eventually go to court, for settlement, for things that will eventually come up after the person is passed. There's a lot of things that happen there. So not because someone was sent there, they're mad. Yeah? There are periods that we go through in life where we all need a little help. We need a little more support, and sometimes just talking will not do. We need a little medication to help us, and sometimes the person is sent to the madhouse, quote unquote, which is Monge Hospital.
Okay, if you are not sexually active, what kind of effect could it have when you're going through menopause?
Another very valid question, because I was confronted recently with a patient, and actually her female relatives, it's a not too young girl, her female relatives were telling her that it will have some effect on her because she's not having sex. She's in her 20s and she's just not ready for that, as she determines it. It will have some effect on her. And it is a perception I am getting that if you're not sexually active as a woman, even in the early ages or later, something will affect you. It building up inside you and you will go mad. Yeah? Yeah, I hear that. I get that a lot. And it has absolutely no effect. As I said, the sexual intercourse does have its benefits, but it is not under my list of treatment or medication for the menopausal period. It actually has no effect. The only thing is you still get the same thinning of the vaginal walls, the itching, the dryness. You may still need to use the lubricant for your own comfort more than to be able to permit sexual relations. So no, it doesn't affect it.
Good evening, everyone. Good evening, doctor. A question. You might have answered before I came in. I'm going to ask anyway. During perimenopause, when the period is unstable, so sometimes it might go from a regular 28-day cycle to maybe 17, then 25, and all of that. How does a person calculate their fertile days? Where is day one? To avoid pregnancy, where is day one?
Glad you asked it. And as we can remember from the presentation, I asked the question, and then I showed you the little picture with the belly. Yes, your fertility is diminished, but not extinguished. So you can still become pregnant. So it is an issue that needs to be treated with during this period. Day one of your menstrual cycle always counts as the day you get the first bleeding, the first spot, the first whatever, pinkish discharge. That's day one. Fertility is supposed to be 14 days later if you have a 28-day cycle. But if the cycle is 21, fertility will be 7 days later. because the period comes 2 weeks after whenever fertility was. But if you start having a 2-week cycle, fertility probably happened or an ovulation. You didn't actually have an ovulation, so you were not fertile at all during that cycle. So it's very hard to determine. And for some women, that's the first time in their life you have to discuss birth control issues, because a lot of us use the rhythm method. Although, as an aside, there's a lot of walking around rhythm method I could show you. It's not a very safe method. But rhythm method is what a lot of women use. And when you get to that point in your life, it no longer works. And that's when we end up in problems. So it's very hard to predict in that time when fertility happened or if you even had an ovulation. So alternative birth control measures are needed. And that is another factor that women deal with. They're not sure when the period comes in. They're not sure when it's their safe days. There's something crawling up the leg. They're sweating and they're moody. It dry and it itching. Don't touch me. Those are all some of the issues that come up why a woman does not wish to have sexual contact with her partner, because those things are preying on her mind as well. So it's a very difficult challenge, and during that period of time, a lot of times the rhythm method does not work.
Based on my hearing this afternoon, I realized that majority of the ladies will have problem with sexual intercourse, having sexual intercourse. What can a man do in order to entice that sexual feeling into a woman? Can a man dress a particular way, give her something, you know, or give her chocolate, or say something? You know, I need answers, because
yes,
my time might be, you know,
might be soon. You know. All right. Now, yes, there are things that men can do to help the situation. You know your partner. Hopefully, by this stage, you know your partner. You know her likes and dislikes. You have to put a little more effort into it. So it may mean texting her during the day while she on walk. Yes, get on with the times. Send her a little text. Lunchtime, you tell her we go meet so and so. If it's half an hour you have for lunch, you take her out, or take her out to the dinner. Yes, so you dress up and take her out. Get the children at a babysitter's, something, so that, you know, a little more investment in the preparation. Women are psychologically turned on more than visually. Men see something and whoops, they're ready to go. Women are psychologically turned on. So you get up in the morning and you did not throw your clothes all about. You pack them up neat. She did not have to tell you to take out the garbage. You took it out before she told you. All that in the back of your mind, later you go organize, you know. So you're starting early. Yeah? You help prepare, pack the lunch kit and everything for the kids, and quarreling with them. Hurry up, brush all your teeth, comb all your hair. Mommy always had to tell all you, come on, all you're big enough. And you're interested in the whole process. So she feel it nice since before she go to work in the morning. And then you send her like a text. Roses and chocolate work for some women, but she looking like the apple and you're selling her chocolate. What happened? So if it's one of those, you don't send the chocolate. But you know what she likes, so you get something she likes. An interested book she been talking about buying, you buy it first. So when she come from work and she throw down the bag and she look around, she see it sitting there with a little note. Yeah, you run home lunchtime and you rest it there because you know she's going to see it as soon as she come. All these little investments in the process leading up to the actual event would help. That she doesn't come home and find the sink pile up with wares that I'm sure and packed there after they had their snack. You wash it or you nag them into washing it before mommy could come and nag them. All these little things will help put her in a better mood to be more receptive. But if she have to do all the day's work, all the everything on top of all the pressures, and all you want to come and do now in the night is tell her about it, she don't want to hear you. So the investment will pay off later.
You spoke about the sagging of the breast. Could it be the other way around where you feel sometimes that it's getting a little bigger and maybe painful? Could it be menopause?
Because I also said that it becomes tender. It sags, but it becomes tender. And irritated. So it's swollen, but it's sagging. You will understand what I'm saying. When you put it in the brand thing, everything is okay. But when you without these supports, it is sagging, but it's tender, it's uncomfortable, you don't want clothes, rush it. Yes, those are some of the things that we do go through. It's sort of how you feel premenstrual normally, before the period, how you used to feel, that also happens, yeah.
How would one know when the cycle of menopause is over?
Well, generally, it's the perimenopause, and she's in the postmenopause. Now, in the perimenopause, it's worse. The before the period stop, leading up to it, is actually worse. When the period stop, it still tail ends because the estrogen has dropped, so you still have the effects. When do you know it stopped? You will know when it stopped. You will know when eventually comes. Life will get better. Things will change. The mood, the fly will stop bothering her if it blow too hard. Things will change slowly. It's a gradual process. It is not like the other things where you can pinpoint today. The menopause is over, the perimenopause is over, and we are safely into postmenopause without symptoms. Because postmenopause is right after the period has stopped. But in the early part of postmenopause, we still having all the issues. Things will gradually improve. She will gradually begin to take interest in other things that went by the wayside during that acute period.
So is there a word as premenopause?
Premenopause, yeah. Yes. Premenopause, perimenopause are usually used interchangeably. Okay, anything before the menopause itself.
I can't remember if you mentioned it in your presentation, but the question is that does the interest of sexual activity for a man who go into andropause is different than, because you said that the woman, she not too interested and all the thing, but in the case of a man, does he have the same symptom as the woman, or you will explain it?
Yes, he actually does, because it's the decrease in the testosterone. So one of the first symptoms and one of the things that usually bring them to the doctor is because they have problems with nature.
The reason I asked too, because I notice, right, that you see a lot of older men, they have a lot of younger girls, and I want to know the question for the reason for it, because if at that stage you think you were declining and you want to have an affair with a younger woman, then I think, well, maybe you're feeling like an 18-year-old again, a young boy again. So just want to make sure it is not a myth.
Yes, a very valid point. Actually, what happens is that's a lot of cultural and other things coming in that you feel it declining, and to prove to the world that you still have it, you attach. And then we end up with some of the problems we do have with some of the great drugs that were created for people with ED, such as Viagra, etc., being improperly used. And we ended up with the catastrophes that we have had, because they were designed for a purpose and they work wonderfully well for the purpose they were designed. But a lot of these elderly men would use it in an effort to prove that they still have it. So it does decline. It is a natural part of aging. That's supposed to happen. That is what is supposed to happen. You hear the stories about if you overuse it, then it happens sooner. And all of that is stories. It's supposed to happen. It declines gradually from 30, but after 60, the decline becomes a bit more rapid.
When I was maybe in my 30s, I overheard two women on my job speaking, and that was the first time I heard about menopause. So the topic was very interesting to me, so I listened. So one of the women said to the other woman, when a woman goes to menopause, she don't want a lot of people, So I laugh, I laugh because I listened to it for the first time. So the other woman said, well, that is good. So I am asking the question tonight, is there an increase in some women's sexual activities when they go through menopause? Or just, I want to know. So I want to know what they expect.
Very valid question. Very valid question. If we're talking pregnancy, then we get 1/3 less interested, 1/3 normal, 1/3 more. That would be my presentation during pregnancy. During menopause, there's a general